Gotcha.
He looked it up. He was like, yeah, there's a chart where it's the stroke symptoms and then Meniere symptoms, and they're exactly the same.
Yeah, right.
Mine is the stroke, but yeah, so he said, I'm pretty sure you have Meniere's disease, and that's when I started going down the rabbit hole on like, what exactly is it?
Yep.
And then I get distracted, and then I get a drop attack, and I'm searching, trying to find a solution. Okay. No, it was wild. It was wild. As soon as I put the toothpick in the back of my mouth, I was like, how is this the solution?
Totally.
How is it just? I mean, one thing I had sciatica for a little bit, and I just treated it well, and it went away. But it's like your whole leg gets sore and painful and crampy. Yep. But it's not your leg that's messed up; it's your back that's messed up.
Right.
So like that clicked. I was like, well, if it's nerves, it's like it's everything on that circuit.
There you go.
That made sense to me. Yeah.
Yeah, makes sense to me too. So
when you think about it, like on the surface, you're like, you know.
Yes. Absolutely.
But when you think about it, you're like, oh no, it makes sense.
That's right.
All these line up basically. But only these were lining up, these teeth. And these would be the front of my mouth, right?
Yeah.
So these teeth were lining up, and then, but now with the toothpick that I've been putting in my mouth, like it tends to line up, and now these don't really touch. And I'm almost scared.
Like a pivot.
And then whenever I do this, right? Whenever I'm doing this, I feel like my jaw having to stretch just to get, like my muscle.
Boom.
And then I'm afraid to even do it for too long because I'll get queasy.
All right, that's important.
I'm afraid to get queasy. That's why I won't do it.
Yeah.
But I've been almost like this past week or two since we scheduled the appointment, I've been floating my jaw, trying not to clench down. Okay. And when I came in and when we were doing, okay, well, now I want you to do this range. I want you to clench and then move to the left. And as I did that, practicing in my mouth before we did the T-scan, I started getting dizzy.
Yeah.
Not super dizzy, but I was like, that's the first time
I've
actively been able to trigger the symptoms. Like it was for, I've had the Meniere's for 2 years beforehand. Just the drop attacks weren't really an issue until those 2 or 3 months of last year. And so, but I had no clue what was triggering and what wasn't, and it was like I was walking out of here like, oh man, I'm a little dizzy. I'll be able to make it home. I'm a little dizzy, but man, that's the first time I've been able to get an answer. Like
now you know the connection.
Yeah.
Because you're working those muscles, and then the Meniere symptoms comes on.
Yeah.
So makes sense, right?
Not having drop attacks, like it's an understatement. They're horrible. Like you really feel like the world's ending whenever you're having one. Like because the thing is, like you close your eyes as much as you can, but the whole world's still spinning. You don't know if it's gonna last an hour. You don't know if it's gonna last 4 hours, right? And then some people like weeks. Like some people have had drop attacks for like days on end, and I can't. Like you just don't know, right? And then even after it starts subsiding, right, you still just feel horrible. Like your whole day's shot, and then, but that fear of it might happen again tomorrow. It might happen again. Yeah, it feels like your whole year's shot. Like the trajectory of my life with drop attacks looked very grim, right? I'm like, dude, what am I going to do for work? What am I going to do for this? I can't go travel anywhere. I can't go long distances for work. Like I can't, like in my job, I have to go out to a construction zone. And so I can't even really do a walk because it's a whole safety issue if I do, right? So with the drop attacks being gone, like it's a huge weight off my shoulders. Like the trajectory of my life is just completely different. And then when I hear people with Meniere's having drop attacks for 8 years, I'm like, man, I've had them for 2 months and like consistently for 2 months, and I can't handle it. Like it's like I'm worried about losing my job. Like my job's very reasonable. I'm like, hey, if you need time, if you need sick leave, do what you need to do. They give you plenty of sick leave, right? And so I was never worried about that, but I'm like, man, if this gets worse, right? Like
and you don't know,
and you have
no control over it,
and I had mentioned last time I had put like a toothpick in my mouth when I had a drop attack, and like 50% of the dizziness went away. Like the room was still dizzy, and I still had to lay down and but I could at least get up and go lay down, right?
Yeah.
And so and that was the worst in the beginning. It was the worst drop attack I've ever had. It was crazy, and they were getting more frequent, like every 2-3 weeks. And so
I remember that.
And I was hoping because honestly, I had some. I didn't know what they were back then, but I had some bouts of like vertigo, but it was like every like 6-7 months, and then you can handle that. I was like,
sure.
oh, I have a dizzy spell again, you know.
Yeah.
But yeah, every few weeks, every month, like I can't believe people get used to that. So for me, I was just really looking for stuff, and I think I had mentioned there was I think Dr. Sutter's video of like you don't have to live with Meniere's.
Yeah.
You know, you get a lot of Meniere's videos. Once you start clicking on them, you start getting a lot of them. And I was like, I'll watch that one eventually. I don't know what it could entail, right?
Yeah.
And then you know, I finally clicked on it, and I was like, this makes so much sense. And that was the night I had the big vertigo attack.
Oh, no kidding.
And because of that, I was like, it has something to do with my teeth. And let me get a toothpick and just bite on it and see what happens. And then sure enough, yeah.
Huh. Okay. Right on.
Yeah. So it was strange. And then once having that solution, it was a huge relief. It's pretty dreadful. It's not. If it was once a year, I would be able to manage it. But like, you don't know if it's going to hit while you're driving.
Yeah.
Yeah. And so that was kind of the issue that was happening this past week. So I had a drop attack in April that I ended up going to the ER. And then in June 19th, mid-June, I had another drop attack. I was at home, and I was just able to kind of get with it. I did my typical, hey, put some Flonase in, maybe do a neti pot, maybe clear mucus that's in my eustachian tube, because I was really focusing on the eustachian tube, right? Popping my ears, trying to get the pressure out. But now I'm noticing that my eustachian tube is pretty good. You know, I can pop it whenever I really want to. It's never too much of a struggle, and it doesn't really relieve the pressure in my ear. That's one of the things. Sometimes I'll get the drainage, but a lot of times I don't.
Yeah.
It makes me feel a little better, but it doesn't really do a whole lot. But I think here, and I knew to avoid sodium, but I wasn't doing a very good job at that. But I didn't know that I needed to avoid caffeine, and so I had a lot of caffeine when I had a week off at the end of October, and that's when I had a drop attack on the 30th, another one on the 3rd, and another one on the 4th. And so, and then the one on the 3rd was pretty scary. I was driving back home. I had an hour commute, and like halfway through, I started getting it. It wasn't horrendous, but it was still bad enough to a point where put my hazards on, get on the feeder, and then take it super slow getting home. Yeah. And at that point, I was like, I can't.
No, it's dangerous.
It's not. Yeah. That one was okay. I could feel every single rock on the road, but, you know, just pushed my head against the seat and got there safely. So
yeah.
But if it was a larger drop attack like I got on the 4th and then on the 30th, I wouldn't have. Yeah, I would have just parked my car. Yeah.
So when you say the 30th and the 4th, that's just a couple weeks ago.
Yes, sir. That's why I'm here.
Is that the most recent one? Was on the 4th?
Yeah, I think so. Yeah, the 4th was that one was right after work. Yeah, and then that's the one where I had just watched Dr. Sutter's videos the morning of, and then that night when it hit, I grabbed a tooth. I told my cousin, hey, give me a toothpick right quick, a floss pick, and then I bite on it on this side of my mouth because I know that I watched some video on like the psoas stretching and maybe how your jaw is kind of connected to that.
Sure.
And I was like, I don't know if it's true, and then I noticed, oh, whoa, I don't think my back two molars touch on this left side, and so I grabbed the floss pick, put it down there, and the whole room was spinning beforehand. And like 5 seconds after biting down on and clenching down on that floss pick on the back, like 50% of the vertigo went away, like in seconds.
That's fascinating.
And that's what I messaged him on his YouTube channel.
Yeah.
And so I'm carrying toothpicks in my pocket and I just stick them in my, clench down on that. Maybe it helps, and it feels like it does. And I'm starting to notice that my jaw is really not balanced. Yeah.
Okay.
I started. It's like, oh hey. When you don't notice your breathing until you do, and then you can't stop thinking about it. Yeah,
totally. And that is an apt description for what it is that this malocclusion and all the symptoms that come along with it can be described, because it is very much something that's hard to explain without a reference. Without a reference.
Yeah.
So, and then you start focusing on it and you start overanalyzing, and you notice that there's a little twinge over here and a little tightness over there. And as we go through this process, it's going to be important to pay attention to those. Mm-hmm. But ultimately the goal is to get you back to where you don't have to worry about those drop attacks anymore.
Yeah.
And you have that balance, you have that stability. And once you reach that point, then there shouldn't be, as much of the overthinking going on, you know?
Yeah.
Like you shouldn't have to think about this stuff.
Yeah.
If you have a normal bite, you don't really think about that stuff. You just, you know, go about your business without, you know. But obviously when it's throwing this kind of a wrench in the gears and it's affecting your daily life, that's when it's time to do something about it. So
yeah. So a few years back, I got a throat infection that led to ringing in my ear that wouldn't go away. Every now and then, I'd have to go to my doctor before I got sick. I would have to go and get like a prescription of Medrol for my eustachian tube dysfunction a little bit. Like once a year, like during the season change, like I started getting like trouble with my ear. I'd go take the Medrol, it'd go away, we're good.
Okay.
And then this time it just wouldn't go away. And then before I knew it, shortly after I got sick with the throat infection, I went back to work and I would get dizzy at work. And so luckily the dizziness went away. I'd noticed it like, oh, when I'm stressed out, I get a little stressed, you know, due dates coming up and then it hits me and I'm like kind of out of it for a little bit.
Yeah.
Didn't think of it much. I thought it'd go away eventually. Went to the doctor, would get some Medrol. It didn't go away. And then before I knew it, it was progressing to the point where I kind of just had to live with it. And there was 2024 was pretty good. I didn't really get a whole lot of vertigo attacks or anything like that. I was keeping it at bay. At some point, 2023 is when I had gone to the ENT for a good long while and tried to figure out what was wrong. And we didn't quite get there. I had like a big life event at the end of 2023, so I kind of had to put going to the doctor on pause a little bit and focus on other things. But one of the weird things that I couldn't really get an answer on from either my primary care or the ENT was that if I'm talking on here and it was really loud, I would hear the roaring in this ear. So whenever I hear a noise that I can't register in this ear, it's the roaring, the staticky static on this ear. Mm-hmm. But whenever I would be listening to this ear strictly, I'd also hear a little bit of the roaring on this side, which was really strange. And then I would have a headset at work where I only have a cuff on this ear, and I'd hear it here, and then I'd hear the roaring, the overreacting to the sound over here on this ear.
Yeah.
So I don't know if that's, I don't know. I really don't know what to say about it, but it was just a strange one. And then also, like, if I touch my face on this affected side, I get the roaring, the pff, pff of the static just by touching it. And so a lot of times I would just try to relax, like try to massage the side of my face, and that would help a little bit. Mm-hmm. And massage like right here on my neck, that would help out a lot. Some days. Yeah. You know, I have a laundry list of like things I could try to do to help out, like pulling my ear to relieve pressure. Right, that was one. But yeah, sometimes it was sometimes one thing would work and sometimes the other would work. It's very strange. But yeah, I had spent a lot of time going to the ENT and trying to get it really figured out. And like I said, 2024 was pretty good, so I left it alone for a good while. Okay. But this year I was having a lot of what they were calling drop attacks. Yeah. One of them I had at work, and we didn't know whether it was a stroke or something. Didn't want to risk it. It was during lunchtime. I had eaten some beforehand, and it didn't fill me up, so I wanted to go get some fast food. But and in the middle of eating the fast food, it hit me, and maybe at the time I thought it was food poisoning or stroke, right? So call an ambulance, get there, and by the end of the visit, you know, they give me some Dramamine, test multiple times whether I didn't have a stroke by squeezing, and they came out and said, it was like, yeah, I think you have Meniere's disease. And I didn't quite get I didn't quite get a diagnosis from my ENT. We were at the cusp of getting the diagnosis from my ENT.
That's the nature of it.
Yeah, and so so that was the issue. I mean, and with my ENT, I mean, we did a lot of audiology tests, and she was noticing that there is the waxes and wanes of the hearing loss, right? Mm-hmm. So there'd be some days where I'd be pretty good, but not quite normal, right? I'd feel more than normal, but it wasn't quite normal, and I went back last week, and I forgot to bring my audiology test results, but this year was definitely lower. I could hear the words, and I can hear pronunciations pretty good with the ear. But yeah, that was for the longest time. It was just the ear, so I didn't care. Like, people get tinnitus, you know, people get old. My back's hurting a little more now that I'm 30. Just kind of dealing with it, but really, yeah, it was really rough on the vertigo side. And that started picking up this year. So that's ended up the trip to the ER that was in April, early April.
We're primarily looking at the 6 or so drop attacks that you've had since April. The biggest of which was just here a couple weeks ago, right?
Yep.
How long did that episode last?
So that was the one where I kind of put toothpick in my mouth and it stabilized. After, so 50% of it went away right there and then maybe like 30 minutes to an hour later, I was walking. Yeah.
Okay. But so as soon as it came on, you put the toothpicks in? Is that what happened?
No, maybe like 10 minutes. I was trying to see if it would, like, hey, is it going to come and go? Or where am I at? And I had to go wake my cousin up, which is kind of a feeding on its own. I think one of the drop attacks I had to call him like 7 times to wake him up. It was like on a Saturday and he was sleeping in bed. So I didn't want to bother people, but after like 10 minutes I was like, yeah, I can't. Right. I called him and he came over and yeah, it did help.
So is that typically how long these episodes last, or can you go through like the past year?
Yeah, so the one I had in April, that one lasted maybe an hour and a half, the one with the ER visit.
You had some fast food.
Yeah.
And
then starting from there, it was maybe an hour and a half. Like I was in my car and while I was halfway through eating, my dashboard was doing this and the next second it was doing this.
Oh, man.
And then, so I like reclined my seat, try to calm down, called my family, let them know what was going on. And then after 5 minutes, if it's not going away, called my coworker, hey, call an ambulance. I don't know what's going on.
No kidding.
Yeah. Got clammy, start throwing up. But the throwing up doesn't happen until you try to move while it's happening. If you try to like get around while it's happening, that's usually when I starting to throw up. But I could keep it down if I just kind of lay down on the floor. Yeah.
Okay, and then there was another one in June.
Yeah, that one lasted about 3 to 4 hours because
man, really?
Yeah, well, and then I lay in bed until I felt good enough to get up. So I was in the game in like the living room area, went over to my room and just laid down and waited. Yeah.
Huh. Okay.
So and then that one, I think I did try to flush my nose and Flonase and try to see if it was my eustachian tube, but it didn't really. That was not going to help. So 10:30 was, that was a day where I was out and about with a friend, and it was very mild. It wasn't too bad. I didn't, I just had to kind of just relax and then get home and just wait it out. That was probably like an hour or two.
Okay.
And then, yeah, I felt bad. I didn't feel like I couldn't drive or anything like that, but it just felt like super strange. And I felt it getting worse. On the 3rd, that's when probably lasted about an hour and a half to 2 hours. And then I was good. And then the one on the 4th was maybe an hour.
Okay.
Yeah, the one with the toothpick, yeah.
Okay. Are you able to gauge how, like, the level of the episode, like, as it's coming on? Like, you're saying that sometimes it wasn't that bad, and this other one was pretty heavy. It was much heavier.
Yeah.
Is there any way for you to, like, just mentally go, oh, okay, this one feels like a bad one, or?
Well, it was just because it's almost immediate whenever the room starts shaking.
Okay.
So it's just how much is the room shaking, and then like now I would be able to gauge a little better now. Is it going to last 2 hours? Is it going to last 4 hours? Because the more severe it is up front, the longer it's going to last.
Okay.
Yeah, and there actually was one other one that happened on the 7th. I forgot about that one.
Yeah. And
I noticed that one is I was in a parking lot and had a pretty steep ramp down to the street. And when I did that, it was an immediate stoplight. And so when I went down, I got to the stoplight and then it came on. So I was like, oh, was it the rapid movement, of my head that kind of triggered it? And it might have been. And so I just put it in park, put it hazards. My cousin had to come pick me up.
I mean, you seem like a fairly animated personality. You're moving around a lot, like in your normal day, right?
Yeah, I got ADHD. So I tend to right.
Okay.
When I'm sharing my screen on like meetings and I'm clicking around trying to find the file, everybody gets dizzy,
Okay.
So So with this, I've kind of had to like, hey, whenever I start feeling queasy. So when I start feeling queasy, that's when I'm like, okay, maybe something's going to happen. I need to just settle down for the day. And then at that point, if I'm feeling queasy, I got to like turn my head slowly instead of like, how I normally move.
I see.
Yeah.
So you're guarded.
Yeah. So when I'm queasy, that's another way of me gauging if something bad's going to happen. Like, hey, I'm feeling queasy, something's going on. Let's just take a chill pill.
Yep.
Stop drinking the caffeine. Stop, calm down. And then, but yeah, so like today I felt pretty good. So I'm not super skittish on how I have to control myself.
Right on.
I will say, okay, so I had run out of, so one of the, I think, medicines that I wasn't sure whether it was doing a good job or not was the Montelocast Singular. So I was prescribed that and I had just been taking it. And I think on my April drop attack, I had ran out and hadn't taken it for maybe a week or two. And then I had stopped taking it for about a week or two before my 10:30 attack. So I'm on it again. I've been on it for about 4 or 5 days again. And it also seems to help out.
Okay.
With at least not feeling queasy and not the, maybe that's what will help during 2024.
That's interesting. Okay.
So, because I was taking it all throughout 2024.
So that was prescribed in 2023 then?
Yes.
And they said just stay on this?
Yeah.
For the rest of your life?
Well, I didn't get any secondary side effects on it, so I didn't really care too much. And I have asthma, so it helps out with that.
Okay.
So, like if I go to the boxing gym and I wasn't on the Montelocast, I could tell I'd get a little more winded. So I would get winded a little quicker.
Sure.
Yeah. And so I was like, I don't mind it,
Okay. Well, let's rewind a little bit and go to 2023 when they prescribed that. Can you give me some context on that year?
So that was the year I was going a lot to the ENT. And so the ENT, so that was another little bit of story I can go into. So I went straight in there. I was like, I told him, hey, I have a throat infection. It seems to have led to this ear thing. I've taken 2 rounds of steroids. It's not really doing anything. And she was like, okay, well, that might have been a serious infection. So let's go ahead. And they prescribed me a heavy steroid and a heavy antibiotic. Also, I got an injection in the inner ear with steroids. And none of that really helped out a whole lot, right? And then, in fact, I think it was the antibiotic that I became allergic to. Like after I stopped taking it, my whole back had broken out in a rash, and so none of that really helped out much. And that's when she was like, "Okay, might be something else. And if your ears kind of waxing and waning, let's go ahead and try like a low sodium. So let me also give you diuretic." And so, but the diuretic it had me so like, it had me so dehydrated I'd be gagging all the time. I thought it was like my stomach was upset or something, but it was just I was so dehydrated. I was like, I don't want to take this. Maybe I tried low sodium diet for a little bit. It didn't really do much.
Yeah.
I did from there we did an allergy test and tried to figure out, hey, is there anything there that could be overreacting and causing inflammation? And it was like cockroaches, cats. Dogs. No. So it was mites, cats, dogs, cockroaches. Was mites being the very top. So I was like, okay, well, let's go. Like, make sure there's not a speck of dust in the house. And,
right.
And that did. I mean, it seemed to help a little bit, but it was so much to keep track of. So to keep everything spotless every other day was a little much.
Yeah, for sure.
So at that point, I'm exaggerating, but yeah, it was a little much. So at that point, they were like, okay, well. If it's on the allergy side, my primary care physician, every time I'd go, he'd see that I'd have the liquid in my ear. And so he thought it was eustachian tube dysfunction. So he was like, let's get you on Singular. Let's see where that goes and see what happens. And yeah, I just kept taking it. Didn't really know how much it was or wasn't doing. I don't want to get off of it to have another drop attack without doing anything previously.
Okay, so that's where I'm going with this.
Yeah.
So let's stay in 2023. How many could you estimate drop attacks did you have in 2023?
Probably like 3 or 4. Okay. And then some of them weren't even like full-on drop attacks. They were just getting kind of queasy, getting a little dizzy, and hey, wait it out an hour and we're good. Let's get back to work.
Anything before that at all?
No.
Not in your life. Okay. Any other significant medical history or trauma growing up?
Not really.
Okay.
I mean, one thing I was trying to do before coming here was going to the dentist and trying to figure out, hey, where exactly did I get fillings? Because I think I did get some fillings on this side. And what do? They get the paper, you bite down, hey, you know, let's shave it down. Hey, does that feel good? I'm like, I guess. I don't.
I'm telling you, that's it right there, man.
So, and I think I did have one feeling, but I don't know where it was at. Like, so that all started in, what did I say, May, late May is when I got the throat infection. And I think late April, early May is when I went to the dentist. And I didn't go back and get. What
year is this now?
This is 2023 when it all started.
Yeah, okay.
So I wasn't sure whether it was like, hey, I can't remember. Did I get filling that day or that, you know, right before the throat infection? I can't, I would need to go back to the dentist and see. Oh, this joint pops.
Okay, your right side pops.
Yeah.
That's interesting. Okay, so your symptoms are primarily in your left ear, but your right TMJ pops. So that's another thing that kind of, it's a puzzle, right? Mm-hmm. What's that all about? Mm-hmm. I'll explain that to you once we have your data today.
Interesting, cool. Yeah, there's those jokes. It was like, oh, hey, doctor, my arm hurts when I do this. Well, stop doing that.
That's right.
So, like, I just tried not to pop it whenever, like, there's a certain pattern I have to do to pop it. But yeah, I try to.
That is a sign. That is a sign, and we are going to connect it to the big picture for you as well. So typically with DTR, it is primarily reductive, meaning that we adjust the bite by polishing and taking away some of the outer enamel, just microns of it. There may be a little bit of an additive component if we need to increase your vertical dimension, which is essentially what you did with your toothpicks. So when you put toothpick in there, we could accomplish the same objective by putting a filling or a crown or an onlay over top of and increasing that contact there. You see what I'm saying? I'm not saying that's what we're going to do, but it's something that we'll take into consideration. It's an option. Interesting.
Well. Yeah.
So for this morning with our diagnostic appointment for DTR, it really is just about generating these discussions, finding questions that you may not have had before, answering questions that you do have, and then really laying everything out in front so that we can connect all the dots, including the TMJ clicking on the right side, including this, and get to a real confident diagnosis.
Yeah.
Okay. But I don't like to be rushed for that.
Understood.
So that's why we kind of have the office to ourselves, 3 or 4 hours.
Yeah.
Where we sit down first for a half hour, chit chat, get to know you. Yeah. Kind of explain some of the basics of what it is that we're doing this morning. And then we'll take it next door and get the digital impression with Veronica. And then we will hook you up to the T-scan and measure the bite itself. And I'll connect the bite to the digital impression so that you can see which teeth are part of the problem. Okay. I don't know how many videos you've seen, but especially with Meniere's disease, there are stories of patients who, after their initial round of the bite calibration, they have an episode worse than they've ever had before. Okay. All right. And in my understanding of that, what we're talking about is that's the window of time when your muscles are responding and readjusting. Yes. So the idea here is if that tension, if that hypertonia is being elicited from a bad bite, then when we adjust that bite, it gives the muscle a window to breathe a little bit the way it should, right? And then recover. And that can take 72 hours. Yeah. All right. So that at 24 hours, when that muscle is like, then you may be on the floor. Yeah. You know what I mean?
Yeah. Okay.
So
I understand.
Brace yourself for that because the therapy itself, DTR therapy, is super conservative. I don't have to give you a shot. I don't have to numb you at all. Nothing like that. It's just going straight to the contact and just buzzing off a few microns. That's it. It's almost like polishing the teeth. Yeah. So the changes that we're making to the bite, they can have a significant impact on the whole system. But those changes are going in the right direction towards a better balance as opposed to unmeasured changes to your bite that can throw everything out of whack. Yeah. So you didn't get here overnight. And I don't think that we're going to get out of it overnight either. I think it's going to take multiple visits. So,
okay, understood.
It's going to have the most impact right off the bat and we'll decide. Today we're just doing diagnostics. I haven't planned on doing any original bite adjustments today.
Okay.
If we have time and we get there and we decide we want to do that,
okay,
I'm open to it. But typically I prefer to reserve that for a separate appointment so that we can have even more time to learn more, ask more questions. I want you to feel totally comfortable with this, right? I want you to feel confident that you're making a good decision. It's measured. Patients have been through this before. We know what to expect, and we know the limitations as well.
And then do you have a give or take on how like 1 in 2 people get the really bad episodes right off the bat?
I don't.
No. Okay.
I don't. The way for me to contextualize that question is to look at your history.
Okay.
And in that regard, yeah, lately it seems like you've had a little more frequency, right?
Yeah. Yep.
But going back then, you had several months before June, and then you had a month and a half before April.
Yeah.
So if you were having these episodes more frequently,
then
that would tell me that there's probably more layers to the puzzle, right?
Okay. Yeah.
Does that make sense?
Yeah, and I think one of the things too is the caffeine use was something I didn't really know could affect it, and I can tell that like on the days where I try to not have too much caffeine, but I do get over 200 milligrams some days, and then before this last little episode, I just feel a little on edge, right, like you would on a lot of caffeine.
Yeah.
But yeah, I could tell like most of those days here in the past 2 weeks that I've had a drop attack. Those are the days I had a lot more caffeine than I usually do. And so
that's interesting.
Yeah. And I mean, and then one of the things too was I will say through 2023 and 2024, I did get a lot of Medrol prescribed to me. Like every 3 to 4 months, I would get another 5-day dose, where it'd be twice a day, I think. And I could give you those details, but I think my insulin resistance really took a number on having to take steroids that often. I wasn't even sure. I wasn't even aware that it could affect it, but I've already had high insulin resistance.
Yeah. Going
to a gastroenterologist, and so I think that was.
So there's kind of a sneaky shadow in this conversation, and that is the autonomic sympathetic nervous system.
Yep.
That regulates your body homeostasis, right? So that's the fight and flight or rest and digest.
Mm-hmm.
So when you talk about insulin resistance, you talk about vasoconstriction, you talk about just like tension, stress, right? That's all very sympathetic in nature. I do think that there is a component of that going on here. And it's something that I want to explain to you a little further once we have your data. Okay?
Understood, yeah.
So I want to make sure that we take everything into context and that we discuss everything up front. And pretty much exhaust whatever questions you have.
Understood.
This is something where, you can learn a lot by looking online, watching other videos and stuff like that. But when it's your data in front of you, it makes you think about it a little bit differently. And that's an important part of it because it is a process, right?
Understood.
It's not a one and a done. It's not even a cure. It really is just about trying to give those muscles a chance to relax, right? Trying to give the blood vessels, this is where the sympathetic part comes in, a chance to increase their blood flow. So if you're constantly tense and tight, and that's where the biochemistry comes in, the sodium and all that kind of stuff, your blood vessels are ready to go. They're ready to fight or flight. What we want to do is to give them a chance to breathe and get the blood flow where it wants to go, right? And specifically in your left kind of TMJ area. So any other questions before we move on next door?
Man, I don't think so.
Okay. You don't have to have all the questions right now.
Understood.
In fact, it's great when we get new questions once we have your individualized data, right? And your mouth on the screen. So,
because I guess when I do bite, would you want me to bite like I normally would?
I'm going to coach you through all that.
All of it. Okay, perfect.
I'm going to coach you through all that. Yeah. So, and that's what this morning is all about. We have a few different diagnostics. We'd take the trios. We're going to do joint vibration analysis. So we're going to listen to the noises that are going on your right side.
Okay.
And then we're going to connect that to any malocclusion that I see on the T-scan. I'm going to show you on your teeth.
Okay.
What the data is telling me. And I'm going to explain exactly what the plan is before we even get started.
So the past 5 days, my ear got kind of
Started acting up a little
started acting up again.
Okay.
It would be like in the mornings, it would start up, and then throughout the day, it would kind of go away. And so I was thinking it was my CPAP, so I tried not using my CPAP for a few days. But then my ear would just kind of stay about the same throughout the whole day. And so I started using my CPAP again. But I think I know what it is. I think there's a hang up on this side.
You can tell now, right?
Yeah, I can tell now. And I was like, well, it's better if I know which tooth it is. And if I put my finger on the tooth, I could feel the tooth kind of like moving a little bit whenever there's the hang up. So that hang up wasn't there beforehand.
Yep.
So I think that's what it is. So I'm not stressing about it too much, I think.
Yeah, good.
Another procedure.
It helps to have a handle on like what's going on, and having been through the process already, you can kind of self-diagnose a little bit. So
I think it's the second or last tooth on the back on the top.
Perfect.
So
right on. Of course, opposing the lower.
Yeah.
Which is also part of it.
Well, and I'm always like, okay, you think you know what's going on? We'll wait to see what happens with the machine and see if it lines up or not.
And that's how I like to do it too, is to kind of walk through the diagnosis before taking the data. And when the data lines up with the diagnosis in terms of the muscle tension, it's confirmation, right? So I like that you're contributing to that too now, because we can find out if that's the case. And when the muscles are strained like that, if you call it hypertonia, right, which is a chronic hypertension of the muscle, it has a harder time adapting to the daily demands, right? And so, yes, the bite is a component of that. But when you talk about inflammation, there's a lot of other things that can lead to inflammation. Yeah.
Well, and there's other factors. Like I said, I thought it might have been my CPAP causing too much pressure in my ear. So I was trying to rule those out, but it's going to take time. Yeah. And I think, and you warned me in the beginning, there might be multiple factors, right? Let's remove this, and then you can go from there. Yeah.
And once we have the data showing us that everything's in the clear, then if you still have problems after that, then we know that it may be another medical doctor needs to be consulted or whatever.
No, 100%. So, and the thing too is like, because it does take a while for your jaw to settle in a little bit.
Totally.
So I was like, I think the last time I was here, I kind of felt that there, and I'm like, you know how your mouth's going to end up at. So I was like, let's go ahead and just see how it goes. But
ultimately, of course, the goal is to get it to where we don't have to do any more fine tuning.
Yeah.
And you're kind of back to normal. So it feels like we're heading in that direction.
I hope. And I wasn't gonna let like a little hang up. Hey, my ear's bothering me again. I'm not gonna. I'm still, because all that experience that I had where it was like almost 20% of what it was, like it was almost like. It's weird because I would experience that like maybe once every 6 months, and it would only be for like a half day, and I was experiencing that for like almost like a week and a half, I think. of like just all this relief, and I'm like, oh wow, like
Great.
yeah,
Good.
And then I think those few times where like I would have my hearing back for the most part, like it was so strange. It takes some getting used to because I'm now used to hearing everything on this side, and being able to like pinpoint where things are coming from. But now when my hearing comes back on this year, I'm like, where's that coming from? I don't even.
That's
it throws my whole it throws all that out.
Wow.
Out, yeah. Whenever something falls, you're like oh, it's over there somewhere, right?
Yeah.
But then for this, like when my hearing's back, if something drops, I'm like, I don't even know where that was. Like
That's interesting.
Yeah. Or someone calls my name and I look in the opposite direction, and I'm like, oh wait, what? That's so weird.
Wow.
Yeah, when my hearing
I would think about, but
yeah, but it's just your brain kind of getting used to everything, like
right.
the being able to locate with sound.
Yeah. Okay.
Yep.
Great.
And I've been doing a lot of stretching too. And one of the so I'll stretch left to right, open as much as I can, and then I'll also do the forward motion too.
Do you have a better range of motion?
Oh yeah, so I had a little caliper at home, so I measured. I think you said 31, right? It was, I think 31 millimeters was my jaw, my bite opening.
Yeah.
And now and it's kind of weird because I have to kind of lift up my head just to even open my jaw up that far, but
Significantly.
Yeah.
Better.
Yeah. I think I was measuring maybe 37, 38, and then, but the more I stretched, like I was like, okay, well, in order to get to like, I think you said 40 was the average.
40 is kind of the line. I don't know. Maybe call it the diagnostic line. If you can open more than 40 millimeters, then your pterygoids, which help in opening your jaw, are probably in pretty good shape.
Okay.
They may be a little bit strained or whatever, but when they get hypertonic, hypertensive, chronic muscle tension, it prevents you from opening all the way.
Yeah.
And people live with that.
No, and the thing is, I
worked on a case like that yesterday.
And it doesn't. It's almost like when you're sore, like, and you can't stretch your arm out all the way. That you can still kind of stretch it out, but for me, I couldn't. Like, my jaw was stuck there, and I couldn't even.
That's exactly what it is. It's the muscles.
And it felt silly. Like, it felt a little silly. Like, I'd be trying to eat a burger, and I couldn't even. Had to, like, angle it in my mouth. Yeah. But, yeah, but I can tell whenever I'm stretching that, like, if I spend maybe, like, a minute stretching, that I could even open my jaw even further.
It probably feels really good, too.
Yeah.
Yeah, okay. Right on.
If my ear was doing pretty bad, consistently staying at like a 60, 70, maybe a 50, that was my common range before any procedures. Mm-hmm. Like I was at a 20, after the second procedure. Like I could touch my face without my ear buzzing or roaring. And I was actually getting some hearing back, and which was great. It was just great news. But yeah, after the third procedure, I think there's still a little work to be done. And so at that point, it kind of come back, but now it's like at a 40, 50. It's not quite at 60, 70 or anything like that, right? Yeah, so it's still lighter, and then the vertigo is still kind of gone, right? Like even though my ear's buzzing a little bit, the vertigo's gone, which is the most debilitating part of the whole thing.
Yeah, and I remember the first time we sat down and talked about all this, your history of having the drop attacks, or have you had one since we did the initial adjustment?
No, I think, the initial adjustment, I had gone home maybe that day or the next morning. I took a shower, and it almost felt like a drop attack was coming, and so I kind of braced myself against the shower walls, and then it never came.
Right.
And then it went away, and then I was like, oh wow, like that was so strange.
My read on that is that you feel it coming on because the muscle is doing the same thing it's always done, and your body is responding in the same way, but it doesn't actually cross the barrier into a drop attack. Because the muscle has the capability of flexing without being overstrained. Does that make sense?
No, 100%.
That's kind of the way I think about it.
Yeah. No, because it was, it took time. Like, I could almost feel like every day my mouth's kind of changing a little bit. And one of the big things I was telling you was that I couldn't even, the amount of pressure that my jaw was in back then, like, I couldn't even simulate now if I clenched as hard as I could. Like, that amount of force that I had, that I was just, you get familiar with it, you get used to everything, right? And so you don't know what you don't know, and it was just, that's just how it feels like when I close my mouth, and now it's not that anymore.
That's great.
So it was a huge difference of, and I think even after the first time you you removed some of the issues in the back. I closed my mouth, and on this side, I could finally feel my teeth lining up properly, where like they were all actually touching and things were in line. And I was like, wow.
Yeah.
And that was like a sensation where like I remember maybe having that as a kid, but like 20 years with what I had going on, probably plus like.
Yeah, you adapt to it, and it becomes your normal.
Mm-hmm.
And you hear this all the time too. It's very hard to communicate that as a problem to someone without a frame of reference, right?
Yeah.
So that's why these videos I think are so powerful, because I mean you found us through the internet and videos and Dr. Sutter, and that seems to be a common theme, is that patients who find a DTR dentist have reached a point where they're looking for something other than what's available.
Someone like me has to find a solution to something so extreme that's affecting their lives in a hugely negative way. Those people are going to be looking for something like DTR, but I think there's some people that might not have those extreme cases, but still have a lot of these other symptoms that they don't even know they're living with, right? That they don't have to live with anymore. Like I think that, because my cousin, I think he has like 2 pops like on each side of his jaw, and I'm like, hey, you might want to go get that checked out, And so for me, so I'm gonna see if he's willing to, but he has some other dentistry going on in his mouth as well. So
there you go. So there's a handful of these people or these patients in every dental practice.
Yeah,
it's very common, and a typical knee-jerk response for a dentist, and I was included on this, is oh well, a little clicking, a little popping, no big deal. And then of course, oh well, you can pop your ankle, you can pop your knuckles, like it's a joint, right? So is it that big of a deal? And some people can live with it just fine. But what it is a sign, right? And you can choose to ignore it. But if the data from the T-scan shows that the bite might be contributing to that click that you feel, then you're living with a chronic potential problem, right? So it may not be painful and you can get about your life, but what happens 20 years down the line, right? If you're popping and clicking the whole time, is that degrading the joint by affecting the integrity of the disc itself, right? Every time that happens, day in, day out.
I mean, imagine if every time you moved your hand, it popped. Well, it's popping right now, but imagine every single time that you moved, it popped. I have to bite a certain way just to not get it to pop.
Right. Yeah. And people will say that, oh, well, if I move my jaw this way, that way, it's like, okay, well, that's a sign, right?
Yeah.
So I'm a pretty conservative doc, and I don't like to jump to conclusions, but if a patient does have a click in their jaw joint, in their TMJ, it's worth considering at least as far as could it get worse, right? So if you have a pop and a click on your TMJ and you need a crown, or you need some fillings, or you need some dental work, right?
Yeah.
And they're changing the biting surfaces, that's the occlusion. If there are interferences that are introduced that affect the popping and clicking, then it could actually exacerbate the problem and put the patient into a TMD category, where then they have to get referred to a specialist for whatever. And that's where the DTR comes in as well. It's basically a digital approach where we build in the therapy onto the teeth, as opposed to the way you used to do it, which is to put you on plastic, right? With a night guard or a orthotic or whatever, right?
Yeah. No, because even with a night guard, your mouth just feels like it's not where it's supposed to be. Like it kind of just, it doesn't.
And that being said, if it's measured and balanced, this is, okay, so going back to that analog example, sometimes it works. In fact, it probably works more often than not. But if it's not measured, then you're just lucking out.
No, 100%. Well, and then one of the things, too, if it's subjective, like when I first came in, I was like, I think it's over here on this side, and it was just completely
right.
Like I was completely wrong in the opposite direction, right? So I was onto something, but it was opposite what I thought, and so I had to when I started thinking about it now, I'm like really like, okay, well, what's actually, I have to sit there and play with my mouth just to see if I'm actually feeling it properly or not.
And that's why I put so much effort into the diagnostics page on my website, because I have those pictures of the muscles. Conceptually, you can wrap your mind around, okay, this is not single tooth problem, single tooth solution. This is actually a muscular problem that requires an analysis of the whole arch, upper and lower, right? And all the motions that are involved that those muscles are moving the jaw around in. So it's like, it is all connected. And the left-right thing, you know, it makes it a fun, complex puzzle, right?
Yeah, man.
But the more you do it, the more you get familiar with it, the more natural it becomes as far as the diagnostics. And like I said, we're about to go over there. You're already getting it, right? You've been through it. You're like, I kind of feel like this one spot over here. We're going to go measure that right now. And that might be all we do today.
Because on this last one, you told me, hey, whenever you want to come back, just let me know.
Totally.
We're not going to put you on the schedule. You know, when you need to come in, you need to come in.
Yep.
And so at that point, you know, I was like, okay, well, I could easily get down the road like 6 months and still have kind of a bit of an issue and then not call in because, I can deal with it, right?
Yeah, sure.
Yeah, but I think with what I was noticing, because the more procedures you go through, the more you pay attention to how your mouth is moving, I think the more sense it makes. I had a lot of weird ideas on, okay, I feel like this is going on. We redo the T scan, and it'd be maybe something like that, but really what was going on was something else that made sense on why I felt that way.
Totally.
Right? And so for me, it was kind of fun just to it was kind of like a guessing game, right? Like
yes, it is.
Playing Guess Who on my end of Guess Who. What is it? Maybe this is going on, and then we go read the T scan, and initially I was, you know, like I said, I was wrong, and now I'm getting a little better at understanding what's going on in my mouth. And
that's
so,
great.
So at that point, you know, I probably could have gone with a few more weeks, but I felt like now I was paying attention to it, and I'm like, I feel like that is going on. Like first few weeks I was like maybe, and then now I'm like, okay, no, I think that I feel like that's what's going on, because when I would clench, like I'm, you know, it's a little stressed at work or anything like that, I would feel this side taking over, and only my back teeth touching, and then I'd relax my mouth, and now everything kind of goes back to normal. It almost wants to pull everything over here, right?
Totally.
You know, so once I noticed that, you know, and it takes a while to understand and go. It's kind of like when you have a piece of like a corn stuck in your tooth, like from popcorn, when you're trying to get it with your tongue, and you don't like the senses are like tricking you. You think it's there, but it's really over here. It kind of feels like that, where you have to like, I don't know. It takes a while to really to understand, and so that's kind of what brought me in. I was like, okay, I think I know what's going on. But for the last week or two, it's been really good. I haven't had a whole lot of dizziness or anything like that. So, yeah, it was a little frustrating of like, hey, you know, you warned me it's a process, right? So, and I understood that, but having that a lot of that initial like headway, and then having to kind of take a step back just to work out all the details and have to kind of start feeling that way again before I start feeling good. It's a little frustrating, but it's, you know, it's just it's part of the process, and so
you got to be ready for that.
Yeah, would coast around like a 70, 80 out of 100, 100 being the worst before any of this, and so those first few weeks when I was doing really good, I felt like I was between like a 20 and a 40, like coasting around there, which is a huge improvement. And I think last week I was sitting at like a 30, 40, like pretty consistently. Like a lot of the whooshing, the roaring is gone. But like now I just have some like static or whatnot when I'm hearing noises. So my ear's not 100% there yet. No, and then I think I was also blessed that I didn't get any huge drop attacks right after the first initial consults, right?
No doubt.
So you gotta count your blessings, right? So
for sure.
Yeah, I didn't have any huge drop attack issues. Like I was telling you, like there's a couple times where it felt like it was about to happen, and then it didn't, and I was like,
yeah.
Like in my head, I was already like, okay, well, what's the closest bed, and
yeah,
and then who do I need to call to tell them I'm canceling whatever I'm doing today? But yeah, it would just go away, you know.
Yeah.
Like not even a split second, you know, and it would just go away.
Okay. Right on. For patients out there who are looking into this and want to know what we actually do as the procedure, when we sit you down in the chair and we say, okay, we've been through your diagnostics, we've agreed that we want to proceed with this DTR treatment, how would you describe the DTR treatment itself when you're sitting in the chair? How would you describe that to somebody else, what we actually did?
So I would say that, you know, I've had a few cavities and a few wisdom teeth removed, and that's always kind of nerve-wracking. If you hate going to the dentist and you sit down and you hate people being in your mouth, and whenever you get numbed, you don't feel pain, but you still feel like they're working your mouth. With this, I mean, there's no anesthesia, and when they are working your mouth, you do feel the grinding a little bit, but it doesn't feel painful or bothersome at all. You know, and whenever, like right after you do a T, like let's say you do a T scan, and we figure out what's going on, they're probably in your mouth for a total of like a minute, and then they give you a moment, and then you do another T scan. So it's never like they're in there for like 30 minutes yanking and freaking grinding and chipping away at your teeth. It's fairly invasive, which is the odd part, right? It's so weird that what's that adage about, or story where like the princess couldn't sleep, and then they figured out there was like a grain of rice or a needle in her bed that was like preventing her from going to sleep. It feels like it's one of those stories where it's like this small little like layer of tooth is what's causing all this, and so let's just remove that. It's kind of astounding on how like invasive it is, but that's
I guess what you're getting at is the it sounds like what you're saying, and correct me if I'm wrong, is that it seems like a significant change or response to a minimally conservative treatment.
Yeah.
Is that fair to say?
100%, yeah. Even if it was only like relief for a few months, I mean, I don't know, dude. I can't say that for sure, but like where I was at to where I'm now, and I don't know. I would consider success. Is it am I 100% back to normal? No. Who else is, right?
Yeah.
You go have a back surgery and you're never left the same after that, no matter what.
Yeah.
No matter how well it went, no matter how well your recovery was. It's
true.
So I mean, there's always things that are going to affect you, but yeah, no, for me, I mean, again, I got my life back. So
sweet. I'm glad to hear you say that.
No,
it feels good to be able to help.
Yeah, 100%. You know, in the age where we get everything with our phones immediately, it's kind of hard to just pause and be like, okay, well, this multi-month treatment, is it worth it? No, 100% it is. Like, it doesn't, like, you might get a huge amount of relief the first few visits, like I did. It's minimally invasive. It might be a process that you have to spend a few months working on, but I mean, you get your life back. So what's the deal? You know.
Amen.
And I've been talking to everybody I know.
Great.
And there's a lot.
Thank you.
Well, and because the thing is too, like some people are familiar with TMJ and don't really know, and then you talk to certain people and they're like, oh yeah, I think I have that. I always get migraines, neck pains, and I'm like, well, you might want to.
It's a lot more common than people think.
Yeah,
and people just live with it.
And yeah, it's crazy how you get used to it. I think. And the weird thing is, here's my question to you. I don't know how much you can say, but how many people come strictly to do DTR to directly work on their TMD because they know they have TMD, versus how many people come with secondary health issues that are being affected by the TMD? Because I feel like a lot of people that have TMD don't even know that you could do DTR.
That's right.
It's only the extreme cases where you have Meniere's or the other illnesses. Exactly right. You told me that, hey, this is so debilitating, I need to figure something out. And they go down this rabbit hole and find DTR.
And that has been all of our patients.
Yeah. Yeah.
Now, here's the thing. You can see now that this is not limited, this approach is not limited to only TMD patients. Mm-hmm. It also has a tremendous value for normal, routine, everyday dentistry. Mm-hmm. The spectrum that we're talking about, how many patients are interested in DTR, well, I think if more people knew about it, more people would be interested in it.
100%, yep. Because right. you have a decent little niche online for people with, and the thing that gets me is people online call it TMJ all the time, but it's TMD, right? It's a disorder.
Yes.
D's for the disorder. So so that was getting me a little bit. But everybody calls it just TMJ, right? Mm-hmm. And online, when you go down that rabbit hole, you have massagers, you have warmers, you have people trying to do exercises with their mouth, right? Mm-hmm. So there's a lot of people doing that. But I think I've been trying to tell people about it. Like every now and then, if I hear someone that has migraines, it's like, oh, you have migraines? You have...
Wouldn't hurt to look into it, right?
Yeah. It's just it might be caused by that. It was like, do you feel like you're always like struggling to kind of clench a little bit,
So, and that brings me to our DTR screening appointment, which is our diagnostics appointment. Mm-hmm. It has an inherent value in and of itself. That appointment allows us to screen out any worst case scenarios where that patient needs treatment beyond their bite, right? So we know that at the end of that appointment, we don't want to waste anybody's time fiddling with their bite if they need surgery on a joint, that kind of stuff.
Yeah.
Or if their condition is obviously coming from somewhere else and needs medical attention beyond dental attention, right?
Yeah.
But there is a good number of patients out there that kind of get lost in the mix who have these symptoms and they try everything else to treat it. And yes, there might be some relief here and there because we're dealing with a complex puzzle where if this muscle is strained and you massage it, well, maybe it'll relax a little bit and then the symptom goes down.
They tried all these other things. That means they're willing. It affects them so much they're willing to go try all these things. And I think it's only for lack of knowledge, right?
Yeah.
So it's that they.
And that's why I feel like the patients that find us typically have done their homework, pretty smart.
Yep.
You know what I mean? They know enough to know that this makes sense. Mm-hmm. Yeah.
It's crazy.
It is. It is. I remember when I first came upon this, I would say it was like 2016 or so.
Yeah.
Incredulous is the word that comes to mind. I just remember thinking to myself, man, what? You got to be kidding me, right? The dentist is doing this? Okay, maybe I could stretch a little bit and say there's an improvement or something, but to have that significant of an impact on people's lives. And I think part of the reservation is it seems too good to be true, but also the ultimate implication is that people are walking around with dentistry in their mouths that isn't measured and causing problems. And nobody knows it.
Nobody.
The dentist doesn't know it. Patient doesn't know it, their ENT doesn't know it, the neurologist doesn't know it. It's just, so that's the battle I see going forward in the coming decades.